Introduction to CPT. The coding system known as CPT, or Current Procedural Terminology, was developed by the American Medical Association, or the AMA. The AMA annually updates the code sets within CPT. These 5-digit codes are part of the language used by physicians and insurance companies to convey what service was provided to a patient during an encounter. Just as diagnosis codes explain what brought the patient into the provider for the encounter to begin, CPT tells the insurance carrier what services or service was provided to the patient during that encounter. The biggest hurdle that a coder may have with CPT coding is translating the physician's terminology or documentation into a billable service. Physicians communicate in medical terminology, whereas insurance carriers communicate in reimbursement language, or CPT. For this reason, a working knowledge of CPT codes is necessary for correct coding of procedures and services. Insurance carriers accept CPT codes to determine the appropriate payments for the services rendered. The CPT coding system was first published in 1966 by the AMA. The system provided uniform reporting of the physician services performed in the outpatient setting. The first CPT book was a pocket size and only 163 pages long. It contained 4-digit codes along with brief descriptions. The CPT book now has grown in size and description since 1966. The CPT book now contains 6 main sections, which are further divided into subsections and then subcategories and headings. It now contains thousands of codes. CPT is updated annually. The update notifications come out in early fall to allow time for providers to become educated and get their systems in compliance for the January 1 code changes. Coding changes that are announced include additions, deletions, and coding changes or revisions from the previous year. Coders need to review the annual updates in CPT so that the claims submitted are not rejected because of invalid codes or incorrect coding. They are listed in the appendix section of the CPT. The CPT book consists of an introduction, the main body of the book, the appendices, and the index. To locate the procedure completed during an encounter, the coder may need to look at the service in several different ways. Becoming familiar with the layout and format of the book will help the coder to better locate a code. To become familiar with the contents of a CPT book, you should use your book and locate the following. The table of contents for CPT is found in the front of the book. So please look for the following: the introduction, the guidelines for evaluation and management service, then evaluation and management, the guidelines for anesthesia and then anesthesia, guidelines for surgery, then the surgery, radiology guidelines and then radiology, pathology and laboratory guidelines and pathology and laboratory, medicine guidelines and medicine, Category 2 codes, Category 3 codes, appendices, and index. The introduction to the book contains valuable information that will help you navigate through CPT coding. Text, symbols, history, and use of the book are all explained in the introduction. Also found in the introduction is a breakdown of the section numbers and their sequence, introductions for using the CPT book, formatting, explanation of guidelines, add-on codes, and modifiers. Place of service and facility reporting, unlisted procedures or services, results, testing and interpretation and report, special report, code symbols, alphabetical, reference index, and references. Various symbols are used to alert the coder to unique features of the book. Some symbols that may be encountered in the CPT book are noted here. The 6 main sections in CPT are organized numerically by code number, except in the evaluation and management and medicine sections. The main sections are as follows: evaluation and management, anesthesia, surgery, radiology, pathology and lab, medicine. Please note the numerical order. Further, the surgical section is arranged by anatomical site, procedure, descriptors, condition subheadings, head to toe, trunk moving outward. So, for example, in the main section, surgery, you would choose integumentary system, then you would note skin, subcutaneous and accessory structures, and then by the procedure, incision and drainage, which would render 10080 incision and drainage of pilonidal cyst simple. The semicolon is an important CPT symbol. It assists in making proper code selection and separates the main term or common portion from the additional or unique portions of the code. A semicolon example is incision and drainage of pilonidal cyst, simple, and 10081 for complicated. The common part of the procedure code is before the semicolon. The difference between the code 10080 and 10081 is whether the procedure was either simple or complicated. When directly below the main code, indented term is part of the description directly above it. So, for example, 10080, incision and drainage of pilonidal cyst, simple, or 10081, complicated, the term complicated in code 10081 is part of the description directly above the code 10080. Guidelines. At the start of each of the main sections, the coder will find section-specific guidelines. These guidelines define items that are necessary to appropriately interpret and report the procedures and services contained in that section. The guidelines specific to the section of CPT codes are for your reference and are strictly followed. Guidelines are provided at the start of each main section, but guidelines or notes may also appear in the beginning of a subsection. More specific guidance on proper code assignment might also be present. The appendices are located in the back of the CPT book before the index. The appendices in CPT can be summarized as follows. They can be Appendix A through M. The index is located in the back of the CPT manual. Instructions for the use of the CPT index appear in the back of the CPT manual prior to the index. The index is organized by main terms. The main terms, which are in bold print, are organized by one of the following: the procedure or service, organ or other anatomic site, condition, synonyms or eponyms, and abbreviations. Follow this order when trying to locate the term. The main term can be followed by up to 3 indented terms that modify the main term. That is, modifying terms further clarify or define the main term. Some entries have more than one code that applies to a given entry. Remember that a range of codes is separated by a hyphen, and a series is separated by comma. Always verify codes in the main text. Until 1983, CPT codes were recognized only by private insurance companies. Following that time, the Healthcare Financing Administration developed the Healthcare Common Procedure Coding System, or HCPCS, using the CPT codes as part of the HCPCS system for reporting Medicare services. The Healthcare Financing Administration is now known as the Centers for Medicare and Medicaid Services, CMS. The CPT codes that were already in use became the Level 1 or Category 1 codes of the new HCPCS coding system for the Medicare program. Some third-party payers also recognize the additional codes in HCPCS. There are 3 levels. Level 1. These codes are divided into Category 1, Category 2, and Category 3 codes. Category 1 codes are the codes from the main sections of CPT. They include evaluation and management, anesthesia, surgery, radiology, pathology and lab, and medicine. These codes are used to report services rendered by providers. They are mandatory. Category 2 codes are not mandatory, and they are considered tracking codes. In CPT, following the medicine section, Category 2 codes can be located. They should never be used as a primary procedure code. Category 3 codes located in the CPT book after the Category 2 codes are used for the collection of statistical data. With the creation of new procedures and technologies, these temporary codes can be assigned as additional codes to track their use and see whether the procedures should be considered for permanent code status in the following year. Level 2, or HCPCS Level 2 codes, are commonly referred to as national codes. These codes are published annually by the Medicare program and are used to bill for services and procedures that are not included in the Level 1 codes. These codes can be obtained on the Centers for Medicare and Medicaid Services, or CMS, website and from publishers that release the annual edition of the codes. HCPCS Level 2 codes consist of 1 alpha character, A through V, followed by 4 digits. These codes must be approved by CMS before they can be used.